employees to meet your healthcare needs. David Coffey, Senior Vice President of Enhanced Care MD, will lead our webinar today. Thanks for being with us today, David. Take it away.
Thank you, Lori. Yeah, absolutely. Thank you guys for all attending our webinar today. So we're really excited to be partnering with the Insurance Exchange as well as obviously ASID and talking with you guys, their members. And we hope today will be informative and we'll answer some of the questions that I know that you're probably thinking about healthcare, health insurance, that it's probably running through your mind because, man, open enrollment's coming up and there's a lot of questions that are going to go around. So hopefully we can answer some of those questions. That's our goal today. We've got scheduled around 20-minute presentation with some time afterwards to answer specific questions if we were not able to address that in the presentation. But before I get going on this, on our slide, I'd like to introduce Cecilia Harris of Harris Resources, Harris Resource Group, and Cecilia is one of our business partners that we've been working with. You're going to be interacting with our team from Enhanced Care as well as Cecilia's team if you have specific questions when you look at the Enhanced Care program with ASID. So Cecilia, just if you could say hi to everybody.
Sure. Good afternoon, everyone. I've probably spoken with some of you, or if not, I've definitely spoken with some of your colleagues. So you'll see my name, Cecilia Harris of the Harris Resource Group, and I look forward to working with you soon. Thanks, David.
So super. Thanks, Cecilia. So let's get to our agenda and what we're hoping to achieve today. So clearly, this is a hot topic that is really unsettled, right? I bet you guys have thousands of questions running through your head, and hopefully we'll at least touch some of them. But we're going to talk about give you a little bit of a healthcare update on the landscape that we're looking at, because there's a lot going on with the new administration, what's actually happened, what's not happened. So we're going to try to address some of those questions that we think you may have. We're also going to introduce our company, Enhanced Care MD, and I'm really proud to be a part of this webinar. And you know, we're also looking, and we want your feedback if it was helpful, obviously at the end. But we're looking to have another event in November and potentially one in December. We think it's all going to be relevant during this time because obviously a lot of people need to make some decisions. And so we're here to help you through making some good choices, and also hopefully you can see the benefit of having our program. And then we're going to also go through the Enhanced Care Smarter Choices member services, what you get if you choose to participate by choosing our program, and seeing if that will help you and your family. So let's go to some really general questions, because here's the thing, my goodness, what's going on with the Affordable Care Act, or you know, most people refer to the ACA, to Obamacare. What's going to be happening? We've heard so many things. Is it been rescinded? Is it still involved? Do we still have the ACA Obamacare available for people? And we're going to answer that question on the next slide. I bet you're also asking, are we still required to get health insurance to avoid a penalty? And I don't know if you're familiar, but when the Affordable Care Act, Obamacare, came out, it said to every citizen of America, we need to have health insurance, and not health care, but health insurance, just in case if you did get sick, you've got some coverage to be able to help. And if you didn't, you were given a penalty on your taxes when you file. So we're going to answer that question as well. And I know people are going to say, is there still an open enrollment? Because, man, I've heard date changes and so on and so forth. We're going to talk about that. And geez, what do I do? Since if I'm a sole proprietor or have a small business, what do I have to do? What do I do for my family? So we're hoping that this session, well, I know for sure, we're going to help you, give you some confidence on what our program's about, but also just give you some really good info to help you make better decisions. So again, I'm David Coffey. I'm really happy to be here, and I hope that you guys will learn a lot from it. So let's go to try to answer some of these questions. So the Affordable Care Act, Obamacare, has not been officially taken away. So it is still there, and is still, the penalties are still in effect for companies as well as individuals. So I know we've heard a lot of rhetoric going back and forth, regardless of your party lines. It doesn't really matter. The bottom line is that the Affordable Care Act is still fully functional and still out there. Now, it's really meant to try to help people get at least health insurance, but what we want to talk about, it's more than health insurance, because you really need health care, and that's ultimately what we want to talk to you about, and how you can get that. But certainly the Affordable Care Act has not gone away, even though I know there's been a lot of discussions about that. There has been an executive order from President Trump, about, hey, go easy on the business owners, but that's kind of vague. Go easy on the tax penalty side. So I am not, the truth is, if I was a business owner that had over 50 full-time employees, you are still responsible to provide health care to those, or I'm sorry, health insurance to your employees that is affordable. So as individuals, there was nothing that directly addressed for individuals. If we do not have health insurance that's offered from our employers or our own business, will we be exercise the penalty this coming year? And the answer is, I would plan on being conservative. I would say you definitely want to have health insurance and have a health insurance policy. It's good for you. It's good for your family. It makes sense to do that. I would say, I would be prepared that the penalties are still going to be in effect. So I've not seen anything that says they've been removed at this point definitively. Now, obviously, there's been a lot of discussions about doing something, but there hasn't been an official word saying, okay, no longer are the penalties enforceable. Now the next question comes is, well, what about open enrollment? Now, the last few years, open enrollment for general enrollment for the nation for non-Medicare people. So Medicare is ages 65. If you're about to turn 65, you have an open enrollment for Medicare. That's still in effect, the same as it has always been. And it's actually, I believe it starts 10/15. So it's going on in the next few weeks, and it's going to go through part of the before the end of the year. So open enrollment for Medicare is still there. But what we're talking about, open enrollment, is for general individuals and families to get health insurance on their from a personal standpoint. And what's happened is healthcare.gov is still in effect, still offering plans, but there are certainly insurance carriers that have chosen not to participate anymore. So unfortunately, the options are getting less available, and this is all going to be based on your state and which insurance carriers have chosen to participate or not. Some notables, I know that United Healthcare has said, we don't want to participate, but they still offer individual plans. And there are private exchange opportunities that those carriers will still offer personal individual health insurance on those exchanges. And part of your, if you choose to participate with Enhanced Care, we have a private exchange that would allow you to look at other insurance carriers for your personal insurance if you need to. But here's the big news that we need to talk about. Typically in the past, we had from November through parts of January and February for open enrollment. They have changed that. That's been definitive. The open enrollment now for this coming calendar year starting January 1st, 2018, open enrollment is from November 1st of 2017 to December 15th. That only gives us 45 days to look at the plans that are available, select the plans that make the most sense for our family, and go through the process. So I bet a number of people may also ask, is there still going to be subsidies? So this is a discussion that hasn't been clear as well. I cannot see that the current administration, and again, I'm not trying to be political, I'm just trying to give you some insights on our research from our business partners who are exchanges and insurance carriers. We still believe that there will be some level of subsidy for individuals that qualify. I just think it's going to be harder to find plans. I think that's going to be the most difficult part. But please note, you only have 45 days to select a plan so that you can make it effective January 1st, 2018. So you can pick a plan on November 1st, set it up. You won't be billed until later, but it'll be your effective date will be January 1st, and it wouldn't be sooner. Now, you have to also know that there are some insurance carriers that do offer gap plans, meaning, okay, non-open enrollment times. Let's say you miss these 45 days. What happens to you? So there are certain states that allow individuals to go and buy health insurance for specific timeframes. The only downside of that is if you do have a pre-existing condition, the insurance carriers for those gap plans that say you didn't get it through open enrollment, they can say, we're going to exclude that from a benefit for you. So that's the only downside of waiting. I wouldn't encourage you, if you have issues or things and you want to take care of your family and you want to have your health insurance in place by January 1st, definitely take advantage of this open enrollment period from November 1 through December 15th. Okay, so a lot going on, a lot of decisions to be made for you and your family. I wouldn't hesitate. I would jump. Obviously, you won't be able to start seeing plans until November 1st, because the unfortunate thing is the truth. A lot of these insurance carriers don't have their final rates yet. So it's going to be pretty hectic during these next 45 days that are coming up. So definitely. So what can you do as an individual that may need to get into that plan, or if you're a small business owner? And let me just say this: if you're a small business owner that has under 50 employees but more than 2, right? And you're trying to think about, should I provide health insurance? And you certainly can. If you have over 2 employees, you can buy a group plan, and obviously it's expensive, but it might make sense for you. And I don't know if you guys understand health insurance, but if you have a group that is within that 50 or less employees, the price is the same price for if you had a 2-person or a 10-person or a 50-person staff, meaning the same price per person. And the reason why is it's called community rating of insurance. And so therefore, if you're in that group, you're all going to be receiving that same community rate for healthcare based on the deductible and the coverage and so on. So that's something important to note. What we have found that in certain markets, it makes sense for you to, if you're an employer under that 50 employee mark, to look at the private marketplaces, the healthcare.govs, because sometimes your employees may be healthier, and if they are healthier and younger or whatever, they may be able to get a hold of a more affordable health plan on their own versus you offering a group plan. So there are some options out there for you as a business owner on what you should be doing. But if you're here because of yourself and your family, let's talk about what really is going on. This is what I suggest in the next few days. The next 15 to 20 days before November 1st, I would look at your current health plan, what you currently have. So hopefully you have health insurance, and if you don't, obviously now you know what are some of my needs, what can I afford, and so on. So there's going to be some questions you're going to want to evaluate, but first and foremost, if you do have a healthcare plan, a health insurance plan, let's review it, understand the carrier. Are you happy with the carrier? Are you happy with the doctors within the network? Are you happy with the deductible level, and so on? Well, what's going on? And you're part of a great organization, a great association, the American Society of Interior Design's ASID. And what they have done is, with one of their partners, the Insurance Exchange, which is an insurance brokerage for larger groups, group-type plans, they have partnered up with us because we offer an alternative to health insurance. We have a healthcare plan of services that will help you navigate when you do need care and help you reduce your overall cost of care, because most Americans don't realize that there are two costs of healthcare. One, it's the insurance premiums that you pay, right? And that's only a promise to pay for care or that a portion of that invoice when you go get care. It doesn't say that, hey, I'm going to pay for 100% of it. And honestly, sometimes it's not the best route to do that, because if you have one of those plans that basically you're not paying any deductible, you're still paying for it, but how you're doing it is in your premiums. Your premiums are going to be higher because they're incorporating those frequent users in that premium total. And that's why lots of times we encourage people to truly evaluate their healthcare needs. And a lot of times people are looking for just a solution to cover the catastrophic issues. So those high deductible plans actually work pretty well. If you happen to get really sick, you need to have coverage. But a lot of times, so that's health insurance premium. We all know that. But what most people forget is that when you actually get care, your insurance either requires you to have a deductible that you have to first meet, or you have to pay some co-payment, a co-insurance. So the insurance will cover anywhere from 60, 70, 80, 90% of the bill after you reach certain deductible amounts. But the other portion is what you're going to be covering. So what we have done for the last 7 years, our company, we formed 7 years ago to help business owners, small business owners, to businesses that have self-insured plans, meaning they're trying to help mitigate cost relations. We started our company to help them and their employees navigate the healthcare system better. And why we did that is that we started to realize there are alternative healthcare options out there that most people don't realize because they think insurance is really it. But if they realize that there are other ways to get care more affordably, faster, more appropriately, most people would take advantage of those. And so our company, Enhanced Care, we go under our name EnhancedcareMD, and we have put together a series of healthcare services to help families and business owners help their employees' families navigate the healthcare industry better. And so we're going to talk a little bit about those plans right now. Most people think, oh, it's just a doctor and I need a prescription. Sure, we're going to go through our programs and what we have, but really what we want to educate you first on is what should you be using? What kind of services make the most sense? So let's go through the member services that we have in our Smarter Choices program. ASID came to us because they said, it makes sense. We want to offer our members the ability to get affordable care items when they need it at a good price versus paying those super high deductibles or costs of healthcare. And so if we can help navigate that, that's what we want to do. And we're constantly educating our members on how to use our program better. Just to give you, let me just step back a quick 2 seconds. We have sold over 50,000 individual memberships for families over the last few years. We actually launched our Smarter Choices program about 3 years ago, maybe 3-4 years ago, and we've collected over 50,000 members that are paying out of their own pocket to have our program. They find enough value in the program to keep it. We keep our members, and we show them how to maximize their services that they have. And we have new ways to, most people don't realize that, if you have a pet, that sometimes our prescription savings program helps with pet costs too, pet RX. But anyway, we try to show you all the different ways that you can use your program, not just for your own personal use, but for your entire family that you have in your household. So let's go and talk about the specifics. So we always start with talk to one of our registered nurse coaches. They are registered nurses with over 15 years of experience. Typically, when you dial to talk to one of our nurses, you're connected with one of our nurses within 30 seconds. And that nurse spends on average between 12 to 15 minutes talking about your needs and your concerns. Now, I'm a father. I have a father of 3 daughters. I'm a father of 3 daughters. And when they were younger, what is the most concern? You know, when they have fevers, yes, I have a great pediatrician, but geez, I hate going to the doctor when they say, oh, it's a virus, and you know what you have to do? Just rest, drink a lot of fluids, keep doing what you're doing. And if symptoms change for the worse within 48 hours, please call us back and come back. Well, you know what? I started finding that using our nurse health coaches to first help through triage questions, I was able to start determining, should I be going to my primary care? Should I be using our enhanced care telemedicine doctors from the convenience of our home? Or should I be going to urgent care or to the ER? So I always make that first initial call to our nurses, and they're able to educate us on the right direction. And it doesn't have to be because you're sick. I've even had members who have called for, you've got a colonoscopy for the very first time. So they've called the nurse to get some guidance. So it's a wonderful resource. And again, I didn't say this, but it's 24/7, 365 days a year. It's part of the membership of when you purchase the Smarter Choices program. But you can unlimitedly use that nurse. And the nurse is in English, Spanish, and many other translated languages as well. So that shouldn't be an issue. But let's say the nurse said to you, you know what, this sounds like a sinus infection or something, you know, an acute care item. They're going to give you the option. You can either go to your primary care physician, pay that normal, you know, the average doctor visit is about $150. And so typically people have, you know, a high deductible. You first have to meet that. So that $150 doctor visit is coming right out of your pocket. Well, our program is you pay 0 copay, and you're going to be able to talk to one of our doctors who can write a prescription and diagnose if it makes sense. You can connect via your tablet, your phone, or you can use your smartphone and go and select. The beauty of our program and using our mobile app is this, is that you can look at the doctors that are available on your phone, pick which one that may have a specialty area. Maybe you're calling about for your daughters. We have pediatricians available, so you can click on the pediatrician, and within less than 45 seconds to 1 minute, you're being connected to a doctor face to face using your smartphone technology. But these are some of the most common things that our doctors are writing prescriptions or consulting for. But sinus infections, common colds, bronchitis, urinary tract infections, sore throats, so on and so forth. These are great ways to talk to the doctor. And my wife says it the best. She says, Dave, I would rather make a call from the convenience of my bedroom when I'm not feeling great, still in my pajamas, sitting in bed, than to get all dressed up, trudge into the car, drive to your doctor. Well, first of all, get the doctor's appointment, sit in the waiting, if you can get in that same day, wait until you get there, go get weighed, so on and so forth. You get the whole picture. It's so much more convenient to call. Again, 24/7, 365 days a year. We're there to help you. We're not there to replace your primary care physician role, but we're certainly there to try to augment and make it better. We also, what we find a lot of value is in our dental, vision, and hearing program. This is a network of over, I think we have over 60,000 different dental locations throughout the country, all at pre-negotiated rates for dental cleanings and so on. And what we're finding is just something really important for people to look at: dental, vision, and hearing, the core things. But you're able to get the benefits from that. We also have an RX savings program, because even if you have health insurance, most plans require that you meet your deductibles first. We find that our solution really helps people find out the best price for their pharmacy use. And we found many times that people have found that our program has helped them lower their cost of their prescriptions and find the most affordable places. We also know that, it's more than just your physical health. It's your mind and body are all connected spiritually as well. So we have a program which is included in the membership, more from a holistic standpoint. It's our EC Pathways. It's a great way to learn alternative ways to prepare and help yourself. And finally, this is to help you find health insurance if you choose to. Now, we also sell dental insurance, vision insurance, but really it is meant there to help you navigate the marketplace, because our private exchange where we have all health insurance carriers there, more than just the healthcare.gov insurance carriers. You could go and start to search and find the most affordable plans, compare side by side to 2 other plans, different insurance carriers all at once, and have the ability to talk to a live broker during the course of this open enrollment period and throughout your membership. So it works out really well, because I know if I was you, I'd have some questions that I'm not 100% sure. I'm looking at all the details. I'd really like to talk to someone who understands and could help me on a personal level. And so that's part of our program that's included. So I know I just jammed through our services, but I want to give us enough time to ask some questions. But truly, the future of healthcare is unclear when it comes to our friends with the Affordable Care Act. We still believe that there's going to be a version of that out there. I still think it's going to be important for everyone to get health insurance during this open enrollment period, because remember, there are if you do have pre-existing conditions, you're able to get this without being penalized. So I would take advantage of that this coming year. I really hope you think about our company and our services through ASID, providing from a healthcare standpoint. We know that our members are saving time and saving money, not just by buying health insurance, but really using our programs to help you. And then I hope that if you choose to, you can become one of our members, go to our marketplace, look at the health insurance plans that are available, be able to see if the marketplace is better priced, be able to find the right plan for you. So that helps you and your family, because we look at this as a holistic standpoint. So I appreciate you guys being on this call today, and I know you have some questions. So let me bring Cecilia back, and if for anyone that didn't hear me introduce Cecilia Harris is awesome. She is one of our business partners that we have been working together. Cecilia, you and I, gosh, we both have been huge users of Enhanced Care Smarter Choices ourselves, so we can talk directly about our program, but Cecilia is there as a resource, because when you make some questions or you want to learn more about the program, she's going to be that conduit for you to help and guide you make some decisions. So I'm going to open it up for questions.
David, we do have a question that just came through.
Okay, great.
And it says, is health insurance going up in price in the near future? And if so, can I lock in a better price before this happens?
So great question. So the question is, I've not seen a year that health insurance has not increased. Okay, last year was crazy. We're hearing that this fiscal year we're looking at like a 12 to 13% increase, but I know that's on the commercial side. So we haven't actually got final numbers from a personal standpoint yet. So my fear is that the personal insurance markets are going to increase as well. I have not seen a time that it has not. So for your purposes, you could lock in health insurance plans with a group plan with the current what's being offered. But the reality is the insurance carriers know that, hey, people are locking in now, and you may be able to, take a few percentage points off, but it's not going to make that large of a difference, I think, in the long run. So I hope I answered the question. Hope that helped you.
Thanks, David. That was great. Anyone else that has questions, please don't hesitate to use the app on the side and send over your question.
And I'm just now showing my picture here. You're like, whoa, where did this come from?
There you are.
So I just wanted to let everybody know that I'm a real person and I'm actually talking with you guys. But some of the things that we are consistently hearing from our friends from ASID. We hear that this sounds like a great plan. I would love to have this for my family and offer it. And so there is an opportunity if you go to ASID, and this is not a plug. I'm not trying to say you have to buy our program. Please don't think of it that way. But just so you're aware, we do offer the program so that you could use the program for your entire household. So when you purchase the Smarter Choices program, it's $44.95, and that allows you as an individual and your family to take advantage of unlimited use with our doctors, nurses, as well as the prescription program, dental, vision, and so on. We created the program to help people who did have health insurance, and for people who choose that, you know what, I'm healthy, I don't really need to get to pay that much for my health insurance, so I'm looking for an alternative way to do that. And so we find that many of our members buy it for that purpose, to help augment and supplement their offerings. So Lori, is there any other questions? Because I have something that I know someone's going to ask, and I want to share this if I could. Is there a specific one? Let's go with that.
There's another question that just came in, so would you like that now, or would you like to?
No, let's go with the question first.
Okay, great. How many months commitment do we have to make when we sign up?
So our program is month to month. Obviously, we feel that if you could stick with our program for the year, you're going to see the true value. Most of our members who have started with us have stayed with us through the program for at least a year, because what we find is when they first sign up, they don't have an immediate need to use the program. So they're like, well, I have it just in case I am sick. And Cecilia, you can speak on this. We have had many members that said, you know, I don't need this. I haven't used the doctor yet. I haven't called the nurse. I don't have any prescriptions. I'm not going to get it. So then they cancel. And then what happens next month? they needed to call the doctor or call our nurse or get some guidance of some sort. We find the people that benefit the most from our program are families. Families really can get a lot out of the value of the program, because you use the dental, the vision, the hearing, as well as anytime you call our nurse or a doctor, you're avoiding a doctor visit or urgent care or of any sort. So hopefully that has helped you guys.
Another question, David,
Sure.
and I think the answer to this is yes, but I'm not absolutely sure. So one of our listeners is asking if your services are available in Western New York.
Yeah, actually, our services are available throughout all 50 states. So you absolutely, Western New York is part of our solution. My recommendation, since we're based out of Rochester, New York, so Western New York is our hometown and area, but I would encourage you to go through the ASID website. Makes the most sense. It's the most affordable price point right now. So yeah, absolutely. So all 50 states, our program is able to be offered and sold and used.
Another question about vision and dental. Is the list of vision and dental providers on your website public so that I can see it before I sign up?
Sure. You know, we do have a link for that. I've got you know what? If we don't have it on our website, we'll make sure that ASID has it. How's that sound? We'll definitely show you the dental and vision network. And here's the other side of that. If for some reason your dentist or your eye doctor is not on the list, what we would recommend is there's a way to submit your doctor and your dentist to say, hey, would you like to be part of the Enhanced Care Network? And we would set up a credentialing process, and we are pretty successful in that program, and then they are added to the program so that you could get the benefit as well as they could get some new members on top of it.
Great. Thanks, and keep sending up your questions. And in the meantime, David, I know there was something that you wanted to discuss and make people are clear on.
Thank you, Lori. The one thing that I wanted to add was, telemedicine or talk to a doctor is becoming really popular, which we're really excited about. Because I got to tell you, when we started 6-7 years ago, we were trying to share with people, gosh, it's a great way, because did you know that 4 out of 5 times as you called the doctor, it could have been handled over the telephone. Most people don't realize that, and the doctor can actually make recommendations. But the reason why I'm bringing this up is this, that a lot of times in certain insurance carriers, or certain states, I should say, are now including telemedicine as part of their value to their insurance product. So they provide you, you're paying an insurance premium, and you're also getting access to telemedicine doctors. Doesn't mean that it's your primary care, but it's a network similar to what we use. The difference that I want to share with you is that the insurance carrier is going to be charging you a deductible to use that program versus our program, we absorb the cost of that doctor visit for you. So when you call our doctors through an enhanced care program, the copay is $0. So when you use it, you're not going to be charged the fee. But when you use your insurance carrier, they typically charge the full amount of the call because by law, they're saying that, hey, a telemedicine call is just like if you had a physical face-to-face doctor visit. So why should it be any less from a cost standpoint? So the insurance carrier is going to be charging the full amount. That's what I wanted to share with everyone, where most people don't realize that.
Great.
So thank
Thanks very
you,
much.
Lori, for having us on. Cecilia, thank you for being there with me. And we really do look forward to any questions that you have afterwards. So please keep them coming in, and we'd be glad to answer that. So thank you.
Great. Thanks so much, David, and thank you, Cecilia, for being with us today. And I just wanted to quickly mention also that we will be sending the recording to everyone that registered and attended the webinar. So you will have a copy of this recording tomorrow. So if there's something that you missed or maybe had a question about, you'll have the opportunity to review that at your leisure. So thank you very much for being with us today, and have a great rest of the day. Thanks.